Book Club. The publication of the first edition of the Guide to Assisting Students with Disabilities, Equal Access in Health Science and Professional Education back in 2015 turned out to be a helpful guide for those of us working with students with disabilities in health science and professional education.
That is so true, Jan. And under the leadership of such organizations like AHEAD and the Coalition for Disability Access in Health Science Education, communities of disability resource professionals were able to learn from each other. The publication of the second edition, now named Equal Access for Students with Disabilities, the Guide for Health Science and Professional Education, builds upon the first edition while being informed of the tremendous amount of thinking, writing, and research that has emerged over the past few years.
So it's really hard to believe that we're already on 9 of the 11 monthly book club meetings. We've been discussing the main chapters in the Equal Access book, and it's been a wonderful conversation spanning many topics and sharing experiences.
I know I sure have learned a lot. Let's take a moment and introduce ourselves. My name is Nicole Taylor, and I'm the Assistant Dean of Student Affairs at Wake Forest School of Medicine, and I'm a Clinical Associate Professor of Anesthesiology. My career shifted when I was diagnosed with multiple sclerosis 12 years ago. It was then that I pivoted and started to focus my efforts on education, advocacy, and residency applications through my former role as an Associate Anesthesiology Residency Program Director. And now I'm the Assistant Dean. I'm also a board member for the coalition.
Thanks, Nicole. And I'm Jan Sarantino, supposedly retired and former Director of Disability Resources at the University of California, Irvine, and past president of the coalition. Currently, I am at the University of Colorado Anschutz Medical Campus, assisting as an access coordinator for nursing, pharmacy, and public health students. I also provide consulting and training to universities and colleges with health science programs. Nicole and I have told you a bit about ourselves. Now let's start recognizing some essential contributors to our book.
Yeah, as we mentioned, the second edition of the book, Equal Access for Students with Disabilities, would not exist without the fantastic editors, Lisa Meeks, Nira Jane, and Elisa Laird. Many individuals have contributed to this work. We are grateful to all of the authors listed here on this slide.
This Equal Access Book Club webinar series would not exist without the support of several key groups. AHEAD, of course, the Association on Higher Education and Disability, the Coalition, and that's the Coalition on Disability Access and Health Science Education, our lovely interpreter, Dina, from Designated Interpreters, who's doing the captioning today, and Springer Publications, the publisher of our book. We are grateful for their support of this novel way to explore the second edition of Equal Access for Students with Disabilities.
Like I've said, I've learned so much from these discussions of the monthly book club. Today I'm joining you from my home office in Winston-Salem, North Carolina. As always, we encourage everyone to be respectful and welcome participation and support of each other as we navigate the multiple perspectives of our audience. Today, we will learn from one another and continue to grow as a community. As moderators, our goal is to pose some questions based on Chapter 9, working through complex scenarios and facilitate a discussion. The best way to engage in the discussion on Zoom is by using the raised hand function. If you do that, we can unmute you to speak. Another option is to post a comment in the chat function. Additionally, you can place a question to the moderators by using the Q&A feature. We would love to hear from as many of you that are comfortable joining in and sharing your thoughts, experience, and wisdom.
Say, Nicole, you know, I'm always really nervous to be the first person to raise my hand. So could we do a little practice exercise?
I think that's great.
Okay, so, all right. Is there anyone in the audience who has a special occasion this month? If you do, and you would be willing to say hello to us, would you raise your hand? And then we'll call on you, unmute you, and ask you to tell us what that special occasion is.
I see some raised hands.
Woo. I'm okay. Let's see who they are. Where I don't see any raised hands. Elisa, I might need some help.
I am happy to help. And I raised my hand because my birthday was on Tuesday. So
Happy
I'm going
birthday.
thank you. I'm going to lower my hand or attempt to. In the meantime, let me unmute the folks who do have their hands raised. Let's start with Megan. Megan, you're live. Can you hear us?
Megan.
Well, I'll go ahead and let Dina talk while Megan sorts out her microphone. It may be an issue there because we can't hear you, Megan. But Dina, go ahead for now.
Hello.
Hi.
I'm Dina Leland from UNLV, and I have a birthday in September. As I would tell my students, it is on the autumnal equinox.
Megan, are you able to unmute your mic and share with us?
I'll go ahead and let Cindy talk then.
29 years ago, September 3rd was on Labor Day, and I was in labor on Labor Day 29 years ago.
That's a good one. Hi, Cindy.
Hi.
All right, why don't we move along and get this discussion going? So we're going to start off with question 1. So we have a series of questions tonight. We have 7, so we'll try to work through as many as we can. When dealing with complex scenarios, a DRP must determine and address the access barrier facing a student and then take action to work to ensure the barrier is rectified. What unintended consequences might occur when a faculty member gives a student an unofficial accommodation without involving the disability office? How might this situation be resolved for the student and prevented in the future? I think this is a great question. I get this often in my role too. I see some raised hands, so we will have Elisa help unmute you if you'd like to speak and share your insight with us.
Brian,
Hello,
you're
this
on.
is Brian Hilbert, also from UNLV. If a faculty member were to grant an accommodation without our office, they may not understand the unintended consequences of that decision. And it might, just because one instructor thought it was appropriate for part of their course, does not mean that it will be appropriate for all aspects of the student's program and courses going forward, which can lead to a lot of confusion and hurt feelings.
Brian, I can tell you're speaking from a wealth of experience in that answer. Yeah, I agree with everything you said. Who else would like to chime in? Jan, do we have anything in the chat? Oh, I think you're muted, Jan. Yeah, Jan, we can't hear you.
I don't see anything in the chat on this question. And hopefully someone will pop up their hand. Laura Bulk raised her hand. And Lisa, I'm so sorry. I'm trying to, oh, here we go. There we go. Laura?
Good afternoon. Are you able to hear me?
Yes.
Okay, good, good. I'm calling from Musqueam territory up in Canada. And I think one of my concerns when a faculty provides accommodations on kind of an informal basis is that this kind of perpetuates this process by which disabled folks are depending on sort of the benevolence of people in power to enable access. And so, you won't always have the benevolence of someone in power to co-create access in an environment with you. And so, yeah, I think that's one of the issues that I see with this. And I think it also kind of obfuscates some of the systemic work that needs to be done to make our spaces and our programs more accessible when we approach things in this way as well. So a couple of my thoughts.
Okay, we have another person, Dr. Lisa Meeks, who's raised her hand.
Hi, I just wanted to kind of building on what Laura was saying to point out the potential bias that seeps in when a faculty member is making that decision. And so it may be that a faculty member really likes student A, and maybe student B that also has a disability is somebody whose personality isn't quite a match for the faculty member, and they don't feel as benevolent as Laura said. So then it's opportunities seep in for inequity in decision making and access, which is of course what we're looking for. I think the other thing that really concerns me when these things are being made is one, it's hard to walk back something that a faculty member has endorsed. And so by virtue of endorsing it, they're kind of endorsing it broadly. I think the other thing that concerns me is what is the breakdown in communication between the disability office and the faculty such that the faculty are kind of going rogue? Do they not understand the process? Do they not understand the protections that are in the process for all stakeholders? So faculty, student, DRP, institution that are there, and perhaps kind of bringing everyone together and just restating why we have the process and why it's set up the way it is critical.
Well, thank you, Lisa. And I think we've had, there aren't any more participants who'd like to jump in on that question. So Nicole, should we move on to the next question?
That sounds great. Thank you,
Dan, I
Brian,
see a
Laura, and
few-
Lisa.
This is Elisa. I see a few comments in the chat that you might want to read. I see that Stacy replied as faculty saying DRP have much better options in technology that might be better than what I have to offer. As faculty, I might also have biases and might not be willing to offer what is equitable. Christina added that fairness issue among the other students that may not require accommodations is an issue. And Brian added, if an unofficial accommodation were causing issues, we would try to review and revise it through the official process. We do training with faculty to try to avoid people operating outside of the process. That's an important point. And Laura added to Lisa's comment, oh yes, it's the problem of the attractive versus unattractive student, similar with animals going extinct, who gets the funding and donation?
That's a great note to transition to question number 2. I love that.
Okay, so here's our next question to consider and discuss. When a student encounters a faculty member with a negative attitude towards a disability or the accommodation, what can the DRP do to support the student? How can the DRP intervene to help the faculty member increase awareness and shift future attitudes? And then what actions can be taken on campus to prevent other faculty members from responding similarly?
This is Dina Leland from UNLV again. It's important to first understand why the instructor, faculty member might have a problem with the accommodation. It could be they feel it's an alteration to the curriculum. In that case, you'd have to have a deeper conversation. It could be that they don't understand how accommodations work and why they're important to put in place. Oftentimes, I find that they find it's a fairness issue to others, that they don't, quote, get that. To which then I give my fairness little spiel to them to help them understand how it has nothing to do with fairness. It has to do with removing barriers. But then I think it also goes back to that training for the DRC to make sure they're training faculty, and faculty understand exactly what are accommodations about, why are they there, what is the process. It's not something that's just arbitrarily put in place. There are specific reasons why they're in place and why it's important for them to comply with the request.
Thank you, Dina. Elisa, I don't see any other hands raised. Is there anything in the chat?
There is, yeah. So Erica, who is borrowing Megan's account, says, I think it's important to have training for faculty and educate them on the spot regarding importance of accommodations for students with disabilities. Another good point.
That is another really good point. So let's move on to question number 3. If a student reports to the DRP that an accommodation was not appropriately implemented, what steps should the DRP take to investigate the complaint? Which other office or offices should be involved? What is your institution's specific protocol for reporting of such incidents and the procedure once such a complaint is filed? All right.
Is this a scary question, Nicole?
I don't know.
Well, while folks are thinking about this question, Sue added a question to the last discussion that didn't pop up until we were already moved on a little. And she asked, aren't 2 minds, faculty and DRP, better than just the DRP to determine the most appropriate accommodations for a medical student? Is it possible that my medical school doesn't have a DRP? So what are folks' thoughts on that?
Those are some really good comments about collaboration, and I wholeheartedly agree. And I do see some hands popping up again. Let's jump over to Brian. Oh, I'm having
Hey,
trouble.
this is Brian. So about question 3, it would depend who on your campus is authorized to look into concerns. On my campus, my staff and I can look into those concerns if it's low level. So the question I always ask myself is, can I gather enough information and resolve this concern within my office, or do I need to seek assistance like from counselor, like from our EEO office? But the other thing, and I'm always talking about this when I'm training staff, is there a substantive concern, right? Students can be unhappy and dissatisfied for any variety of reasons, and part of that can be the student experience. But is there a disability-related concern that should be addressed or should have been addressed differently? If that answer is yes, then it's figuring out, right, what happened, what went wrong, how are we going to get it right, and how are we going to do our best to make the student whole? And separating out, oftentimes when these things come, students will come with a laundry list of concerns, right? Everything's wrong about everything. Well, my area of everything is very narrow. So I'm trying to separate out what I'm supposed to deal with, make sure that's dealt with, and then make sure they get referred on to whoever else they need to speak to about those other concerns.
That's great, Brian, and so true. Dina, your hand is raised.
Yes, can you hear me?
You can.
All right, go ahead. I think, along with Brian, I find also sometimes students don't understand, even though we explain it to them, what the accommodation really means in application. I actually had this conversation yesterday where a student came to me and felt like their accommodations were not being effectively applied. And so had a conversation with them and instructors and discovered that they are actually being applied correctly. And the student just didn't have a good understanding of what that application should look like in the new setting. So sometimes that is a problem. And regarding the chat question, two minds better than one with faculty and DRPs. Sometimes that's true if they understand what accommodations should look like when they're applied. And when it comes to clinical accommodations, then it's very important to have consultation with faculty, because clinical accommodations are very nuanced and you need to make sure they're appropriate in every particular setting. They might be appropriate in one clinical setting, but not in another clinical setting. So in that case, yeah, it's very important to consult with faculty. But if we're talking about didactic type accommodations, generally I find that the DRPs do a really good job of recommending and making sure accommodations are in place.
Thank you, Dina. I actually had that conversation this morning. And so it's something that has come up with us a lot. Elisa, how about the chat room? Any comments in there?
Nope, pretty quiet. Oh, wait, I take that back. Somebody just popped one in. Kara says, I feel that it is important that we encourage students to reach out to us if they experience barriers or resistance with the implementation of accommodations. If they reach out to us early on, we can then follow up with the faculty member. Depending on the circumstances, the other offices involved might vary: school leadership, supervisors, legal, etc.
That's true. So true. Thank you. Well, Nicole, should we move on to the next question?
I've already have it queued it up, so it's ready for you, Jan.
So I don't know if any of you have already have a little beverage sitting next to you, but if you need to refresh, please do so. But let's go ahead and get started on the next question. And that is, students may postpone disclosing a disability for so many different reasons. If a student waits to disclose a disability until becoming at risk of academic sanctions, how can their DRP ensure the student's needs are still met? How should appropriate documentation be kept? What actions can be taken on campus to promote inclusion and help destigmatize disability so that students feel comfortable disclosing early and seeking accommodations? Megan, your hand is raised. I hope we can really hear you this time.
Megan, if you're struggling with your microphone, we would love to hear your thoughts in the chat. I'm sorry, we're having some audio issues.
Can you hear me?
Yes.
Oh, good. Well, this is the other Megan. I'll go. This is Megan Matthews. I'm an access coordinator at University of Washington, Seattle, and I've just been in the role a little over a year. And oh my gosh, I have so much I'm learning. But I was going to say I've had a couple of situations. I can answer the first part, but where there's been a few students who didn't get registered with our office or were registered but didn't have the right accommodations in place. And so really working with the department and the deans to identify if when students are put on these academic probations or at risk for dismissal, is there anything in their language that says you must be able to meet these with or without an accommodation? And is there a referral to our office if they aren't registered or even if they are? Because I think what we're seeing is sometimes students are not meeting the requirements because they don't have accommodations in place or don't have the right ones in place. And so there's been two students in particular I've worked with to say, okay, let's look at what they're putting, the plan that they're putting in place, and what accommodations would you need to be able to meet these. And so working with then departments going forward to make sure in their literature and their disciplinary language, all of that, that there's something that points students to these resources to ask for it. They still have to be willing to come forward and ask and then utilize the accommodations, but at least then we know we've given them a chance to meet those, whether they have them in place or not. And then there's some things that are outside of the accommodation realm, right, that are just professional standard. Like there isn't an accommodation that I can give you that says you shouldn't go missing for 4 hours a day. Like, I don't know what you're doing, like, let's talk about that. But I think that's some of the ways we've tried to be more proactive with promoting that and being inclusive to students. And then I've been doing a ton more orientations in the beginning of the year for incoming student groups to just introduce them to us, let them know what qualifies as a disability or a health condition or those things, and to really normalize it. So that's, sorry, I rambled, but that's a little bit about how I've done it when students have come to us later or didn't have anything in place, but were in that academic probation place.
Those are really good comments, Megan, and I'm so glad we were able to hear your audio. I think Cindy Poor has Parisi has her hand up. Cindy?
To address the second part of the question, or the last part of the question, when we attend orientations, just like the last speaker said, we try to normalize students asking for accommodations or coming to our offices. And to do that, we talk a little bit about percentages in general of students who we work with, and even closer to home, how many students in each, in particular, medical school, how many of their peers we're currently working with. Also, we try to ease their worries about their disability information going on their transcript or being given to places that they want to get their residencies on. So we assure them of confidentiality. And I found that once students hear some of that, it really helps ease some of their anxieties and prompts them to get the accommodations that they need for equal access.
Thank you, Cindy. I don't see any more raised hands, so I'm going to ask Elisa if there's anyone in the chat. Okay, this is so interesting because this very thing came up this morning. Again, I had just some real interesting conversations, but a student came to us because the faculty member had asked her if she'd ever been evaluated for a disability, because there was such a disconnect between what she was contributing in class verbally and what she was doing on evaluations. So I think that probably is a good product of the DRPs doing some faculty training as well. And I know that Brian mentioned that earlier, and maybe even Dina, about getting out there to meet with faculty at Faculty Senate or faculty meetings, and just giving some Q&A or some small in-service for those folks to help, so that they know to just be referring students to those resources, not just disability resources, but other resources on campus. Cindy, did you want to add something? Maybe not. Okay.
All right, Jan, so we'll move on to question number 5. As students with disabilities transition from didactic to clinical work, additional barriers may arise that need to be addressed. In your experience, what are some common barriers that students with various disabilities may encounter for the first time in a clinical rotation that could be mitigated with an accommodation? This is always a stressful time as I'm advising students and they're moving from the classroom to the clinical environment. So it'll be an interesting discussion here. Elisa, is there anyone who's raised their hands? I can't see it on my end.
Yeah, no raised hands, but it maybe there, oh, here comes one. Dina.
Okay. I find a challenge moving from didactic to clinical is sometimes the students are not realistic about the accommodations they may need in a clinical setting. So even though I frequently ask, clinicals are coming up, do you think you might need accommodations? They say no. And then they're a few days into a clinical setting and then they say yes, which makes it very challenging for them, for me as well, but that's because clinical accommodations can take a long time to put in place. You know, and so they're really doing themselves a disservice by not even having that conversation of what might be. I'm really trying to help the students be aware of what might be available, experiences I've had with students with similar diagnoses in a clinical setting, and just give them some ideas. But I still find sometimes they're just really concerned, and they're really concerned about it for basically the reason of this book, because they're concerned about being judged and not being valued as much because they have accommodations. So it's really important to help the students overcome those concerns, and so that they're willing to accept what is going to help them to remove barriers and perform and demonstrate their knowledge, because they have the knowledge and they do have the ability to perform with accommodations in place.
Dina, I think that is really true. I think what I encounter too as I'm advising students about different specialties is not always being familiar about what those environments look like ahead of time. So having a harder time anticipating the barriers too. So yeah, I find that in our discussions about residency long-term in a career with certain disabilities. So yeah, I really like how you framed that.
I don't see any other raised hands at the moment, but a couple folks did contribute in the chat to the question about what additional common barriers were arising in clinical settings. Marie added leaving for weekly health appointments. Kara added one barrier that I have experienced has to do with standing tolerance.
Yeah.
Yes, those are both very, very good. So anything else? One last chance to chime in on this question before we move ahead, Jan.
I see that Megan added one more comment just now. You can encourage an orientation for the student prior to starting in clinic so that they can see what some barriers might be.
Yes, a little shadowing experience. That's a great idea.
Okay, Nicole, let's go ahead and present question 6 for everyone's discussion. And that a student with a disability may need to take time off from school to take care of disability-related health issues. Another thing that came up today, this very day. Yikes. So what are some of the challenges students may associate with taking a leave of absence or LOA? What is your institution's policy on LOA? And what are some creative accommodations that may allow a student some flexibility to remain in school by providing the opportunity to fully demonstrate the competencies required in each course? How might these creative solutions differ if the student is in the didactic curriculum versus the clinical curriculum?
This is a loaded question, Jan.
Well, we got a lot of smart people out there.
We sure do.
good experience, and I'm really hoping to hear from
Mhm.
more voices out there.
So Lisa just added in the chat, one of the greatest challenges is the cost to step away and fear of quote unquote losing knowledge during that break.
Especially in some of those lockstep programs. When you have to wait maybe an entire academic year to get back caught up.
So Jan and Nicole, how would you help a student who had concerns about the costs, and that could be costs financial, or it could be costs, personal costs of stepping away for some chunk of time, or that fear of losing knowledge during the break?
Well, I can speak from the perspective of, say, the nursing program. Stepping away for a period of time and then waiting a year to come back. Losing knowledge is a real concern. Maybe not immediately in the return, although there's also that awkwardness about returning and being with a different cohort because of that, but also that original knowledge, the original learning that took place is now that much farther away for when you sit for the NCLEX or the licensing exams. That knowledge becomes, maybe 1 to 2 years older, and you're being tested on more current information. So there are a lot of consequences to that type of situation. But mental health, physical health, medical health has to sometimes take priority. And so we just need to find ways to help that student. And I see that my dear colleague, Emily, has her hand raised. So Emily, I'm going to turn it over to you.
Hello, my name is Emily McGee, and I'm at the University of Colorado Anschutz. Excuse me. One of the things that I want to talk about was being proactive. So if it is a health-related concern and you could possibly have a student take their weekly appointments so that they are able to maintain their health and stay as stable as possible. I think if it's mental health related, again, those weekly appointments and really encouraging the student to take care of their mental health or to take care of their physical health as much as possible. And I think if we can be proactive in some of those accommodations that might allow a student to stay more stable while they're in their program, then that could help to avoid a leave of absence if possible. And then I think that also provides some of that flexibility. If it is a need for appointments, or if it is a need for a decompressed clinical rotate schedule, so that you have more time to go through each of the rotations and still be able to tend to your own health. So I think being proactive in accommodations is one way to maybe, if we can mitigate the need for leave of absences before it really gets to that point.
Thank you, Emily. Other comments or suggestions?
I don't see any raised hands. I'll note that Cindy added that she was agreeing with you, Jan, when you said that concerns about getting out of step with one's cohort are, can be a problem because it's often their support structure.
Yeah.
I think Dina has her hand raised.
She does.
It's also important for students to understand if they are struggling academically and at risk of failing and then not being invited back to the program, that oftentimes a leave of absence is better, especially if the reason for their possible failure is disability related. And oftentimes that's hard for students to hear. And it needs to be addressed very gently. And oftentimes they need to hear it more than once before they actually hear what you're saying. That it really is often in their best interest to take a leave of absence rather than failing out.
Dina, that is so true. And if we look back to so many programs and their technical standards, professionalism is usually one of the components, and being able to express yourself to your faculty member and being proactive, like Cindy was talking about, and Dina, that really could fall into that professionalism competency. And so it is really imperative that students get that message, not only from us, but also even from their technical standards.
Jan, too, I'd like to piggyback. One of the things that I find with the students is they're really afraid of like how this is going to look down the road to residencies, because there is a little box on the application where they can kind of weigh in about the leave of absence. And one of the things that I really stress with the students is the importance of that insight of needing to step away and taking care of themselves and being able to step back fully into the program. And, you know, it's a lot easier to put a narrative in that box explaining their leave of absence. So I definitely encourage that too. So I think that's one thing that I find with a lot of students is they're really afraid about how it's going to look later. And I really stress the importance of taking care of themselves and being able to say in that box that they, you know, have come back now and have taken that leave, but, you know, are ready for the curriculum and the rigors of residency. So.
Oh my gosh, that, yes. And I was just recently talking with a student who was in this very situation and doing very well academically, but had to take a medical leave of absence because of a physical disability. And his advisor in medical school was able to write a supplementary letter of support to add to the match information, saying, you know, great student, great clinician, had to take this leave of absence, came back, got right back, you know, and so, you know, if you have if you're using good professionalism while you're in the program, you know, that's another plus for your advisor to be helping you out. Dr. Meeks, Dr. Lisa Meeks has her hand raised.
I just wanted to add one thing to what Nicole was saying, and I'm not going to take credit for it because it comes from my previous boss, Dr. Maxine Papadakis, who is at UCSF, who was amazing with students. And one of the things that she used to say that I thought was so important was she kind of flipped the focus. And what I mean by that is, instead of saying, what is it going to cost you if you step out, was what is going to happen? What are the consequences if you stay in? And for so many students who might be on a little bit of a spiral, you know, the relationships that get eroded, the grades that get eroded, the knowledge, if you're not doing well for a myriad of reasons, and you're not able to learn, if you don't have that rapt attention, you're not learning as much, you're certainly not solidifying information as much. So we focus a lot on what gets lost if you go out, and you guys know how I feel about leave of absence. So at all costs, if students can stay in, that's great. But at the same time, we really need to think about what the cost is to staying in. And does the student need to step away, take care of a few things, and come back stronger and, you know, with more quality of engagement in the curriculum and more quality in performance? And so just reframing that for your learners, you know, we allow a lot of autonomy and decision-making around this, but really helping your learners understand all of the benefits and consequences of this decision. So that's all.
It was interesting, Jan. One thing we didn't really speak about in this discussion, and we do have time, we have 16 minutes, is some creative accommodations that may allow that student to be in school still, if they were. I was wondering if anyone in the audience had some creative accommodations.
I know you have them. I'm just waiting. There's one. Dina.
We have in the medical school, we have had their clinical rotations moved around so that the rotations that really exacerbate their diagnosis are maybe at a later time, which gives them time to get care for their diagnosis, and then able to perform, 6 months, a year later when they're better healed. We have found good progress, good outcomes with doing that, even though it's challenging for the medical school to rearrange, clinical rotations. They have done it, and we have found success with that.
Thank you for sharing that, Dina. Right, well, let's move on. Jan, we'll move to question number 7. And I think this is me. The DRP is responsible for maintaining records and notes on the interactive process and ongoing communications with the students. In the event that a new DRP arrives and finds an office lacking complete records, what actions could be taken to ensure the records are kept meticulously moving forward? If a new DRP is informed that a student is up for dismissal and there are no records in the disability office, what action can the DRP take to document the student's disability?
So I guess this has never happened on any other campus except ones that I've been involved with, Nicole.
Oh, no.
Go to everybody else's school.
And the hands are going up.
Okay, thank you. Emily, let's turn it over to you first, and then we'll slip right over to Dina.
I think that just making sure that you have a system moving forward and that the system is in place, everyone understands what it is, that it is consistent, and that you're going back and ensuring that your notes are complete after you meet with a student. And then I think if there were a student up for dismissal or just a student coming to the office in general and saying that they have received accommodations in the past, but you don't have anything, I think just trying to walk through and find out from the student what they report has already taken place. What accommodations do they report that they've received? Who has implemented those accommodations? Because then you could reach out to those faculty members and see if maybe they ever received a notification via email that they could share with you. So you'd be able to have at least some historical documentation.
Thanks, Emily. Let's move on to Dina and then Brian.
I would, if there were no records, which I actually can't imagine, the department, the health science department, whichever it is, should have documentation about the student. And they too should be keeping records and should have some documentation about conversations with the DRP or even their conversations with the student that could be shared with if a new DRP comes in and doesn't find enough documentation to have understanding of the situation. So that would be a good resource for getting documentation. And in terms of if a student is up for dismissal, again, it would be logical to me that the DRP is not the only person keeping records of these conversations, but again, departments have policy on documentation and keeping records, especially for something as severe as a possible dismissal for a student. And one thing that's very simple, I'm sure that everybody's aware, is just looking back at emails. And if you just, copy your emails from your students, copy and paste directly into the notes, it's a very quick and easy way to create documentation.
Thank you, Dina. Let's go with Brian, and then I think we have some good information in the chat. I'll let Elisa share with us.
So back in the bad old days, I actually have gone to my supervisor's supervisor and gotten access to previous staff email accounts to go through and see what communications had happened. It's not fun to do. It's a pain in the neck. It's a lot of work, but something exists somewhere. But an easy thing that's super helpful is never underestimate your ability to blame high stakes testing providers and licensing testing providers in why you need something, right? So oftentimes what I will say is, I don't need this for my process, but in getting prepared for step one, or I work with law students as well, in getting prepared for the bar, you're going to need X. So why don't we get that together? And then see what's going on. And I have worked in several offices where we had to go back and really fix some bad practices with a lack of lots of things. So it happens, and you just do your best to move forward, realize where your points of need are, and what information can you get.
Fabulous, Brian, fabulous. Elisa, I see there's some comments in the chat.
Yeah, so there's at least one here from Erica, who said, we create student encounter documents, which is just a simple Word doc, to ensure each meeting is summarized so it doesn't become a he said, she said situation. We upload to a shared drive so all team members can revert back and all are aware. We will also have meetings with mental health and wellness and student affairs to see if they have additional information on the student.
That's right. Some of those behavior teams, care teams, also have information that you may be able to access in one of those crisis situations. Good comments, Erica. Thank you. I'm waiting to see if anyone else is going to raise their hand on this question, because we do have a couple minutes left that we can chat.
It
I'm
seems
just
to
so
me
thrilled we
that
got
we've
through all 7. Sorry, Elisa.
No, I totally agree. Yeah, some of these book clubs, we barely get through 4 or 5 questions. So you all did a very nice job of shepherding the conversation today. I was going to suggest that there's been a few times where people have identified a barrier, and we didn't necessarily talk through what the potential solutions for that barrier might be, what kind of accommodations may be appropriate, of course, depending on the student and their individual needs. But I don't know if there's a couple that jump out, Jan and Nicole, in your memory, or if anybody wants to quick type in the chat a particular barrier that you, really are having a hard time figuring out what the best remedies might be, or approaches might be to try even. So this seems like a good brain trust, the folks who are on this webinar right now, to get some really good suggestions while we're all here in the next 5 minutes.
Nicole, any thoughts?
No, I think that's a great idea about the barriers. I mean, I was actually speaking with he's a fellow, but we also have a student about difficulty getting the clear masks. And I was wondering if other people at other institutions have known to have struggles, because we've been having some struggles getting some of those. I don't know, inventory is just low in North Carolina, or Dina has her hand up.
In terms of the clear masks, in our dental school, they struggle with using the clear masks in a clinical setting, even though they're the same masks that we provided and are being used in our hospital setting. But our dental school says, and I'm not saying they're wrong, but that they don't meet their standard for the masks in the dental setting. So that's very challenging, because we do have a few students who are hearing impaired, and those clear masks really help them. So we found workarounds for that, but that was a challenging obstacle.
Yeah, Dina, that was half of the struggle that we were having as well in the operating room. So very similar, I think, environment.
I see in the chat earlier, a half hour ago, a couple of folks suggested leaving for weekly health appointments was something students struggle with, and standing tolerance in the clinic. Are those things that folks have ideas about?
So we have a couple of students with that situation of the standing tolerance, and we're finding that using the cane stool really helps with their mobility and being able to sit very quickly in almost any setting. You know, even if they're rounding with their attending, they can sit. It turns out to be an extra long patient visit, and they can use their cane stool to sit down for part of it. A lot of times they want to sit near the door, so if they do have an issue, that they can stand near the door so that they can exit the room quickly. Yeah. And I see that Dina mentions that they had a cane stool. I also mentioned, I noticed that Lisa Meeks has a comment about in the chat. Elisa, if you want to take that one.
Oh, sure. So going back to the mask discussion, she noted that there's two different types of clear masks, the FDA approved for clinical settings type, and then a lesser rated type that's more like the kind of day-to-day masks that we may all be wearing around the stores and things. And she noted that currently there's a minimum amount you have to purchase for clinical FDA rated masks. That's about 15,000. So that it may be outside of what a disability office can purchase.
Thank you, Lisa. That's very helpful. Do you mind shooting me the name of that so I can advocate with the DRP at our institution?
Hopefully Lisa can put that in the chat to everyone. If
That
there's
would be wonderful.
URL or anything she can share. Marie added that for weekly leave, informing students as far in advance as possible to try to move their appointments to later in the day when they have clinical obligations in the morning of class, because clinical rotation content is heavy in the morning, at least at her school. So that's a great suggestion.
Okay, we've got that link there, and Nicole,
Perfect.
our time is winding down.
Yeah. So as you know, we have several book clubs recorded, so feel free to listen to the previous book club recordings and join us for our upcoming discussion in October. So feel free to jot down, let me advance the slides so you can get the bit.ly address on it. From this website, you can register for the next 2 sessions. You can also see the facilitators for each chapter as they keep changing. We do change them, so you get different people each time. And the discussion questions in advance to help guide you as you read through the chapter and prepare for the next book club meeting. Please feel free to use these questions if you decide to have your own equal access book club, which we really encourage you to do on your campus to help educate your other colleagues and peers.
So let's talk just a second about the book. You can get a copy of the book through Springer Publishing, their website, with the discount code found on the registration page. And I think that was Book Club 25, if I remember correctly, but I don't know. So you'll have to go to the registration page again. But just want to remind you that oh yeah, it is on there, Book Club 25. So just a quick reminder that all proceeds from the sale of this book, like the last edition, go to the Coalition for Disability Access and Health Science Education. Nicole?
All right, and thank you all for just a wonderful discussion, and then we'll go to the references, Jan.
Okay, so here are some of the resources which can be helpful for you. We also want to remind you that many of the topics discussed during the 2021 in this Equal Access Book Club webinar series. Next month, we cover Chapter 10, Debunking Myths. And I'm going to tell you, I don't think you're going to want to miss this one, because I have used this information so many times in talking with faculty and and administrators. So that's going to be debunking myths and addressing legitimate concerns, facilitated by Christine Lowe and Joe Murray.
We look forward to seeing and hearing from you over the next few months in our Equal Access Book Club webinar, Friday, October 15th at 4 p.m. Eastern Standard Time. So mark your calendars and make sure to register as the spots are limited.
Thank you all for coming. It was so great to hear from all of you. Please take care and we'll see you next month.
Good night.